Hello everyone. In this session, we are going to discuss asthma. It is one of the chronic obstructive pulmonary disease that is COPD. In your university exam, you usually get a long question on asthma. You have to write down everything, or you get a short question, especially on the pathogenesis of asthma. So let's start the topic. Asthma. So let's start the topic asthma. So before starting the topic, let me give you an overview. We know there are 4 types of COPDs in our syllabus. So we have chronic bronchitis, emphysema, bronchial asthma, and bronchiectasis. So currently I am teaching you asthma in this video in this session. And I request all my dear students to watch all 4 COPDs at one shot in a binge watch so that you have a better understanding. So I'm assuming that you have already watched chronic bronchitis and emphysema. So here we are discussing asthma. So as we discussed all the COPDs under a fixed set of heading, asthma is also discussed in the same headings. First of all, I will let you know the introduction of asthma. What is asthma? We will define asthma. Then we will see the level of obstruction in the entire respiratory tract. Where is the obstruction? The location of the obstruction. Then we will see its etiology, its pathogenesis, types, gross, microscopy, and finally the clinical features. Most important among all these headings is the pathogenesis, on which you get many time repeated question in your university exam. So please concentrate. Let's start the topic asthma. Before starting that, we will again revise the respiratory tract once. Okay, so the respiratory tract start with the nose. We start the inhalation with the nose. So it starts with the nose. The nose is leading to pharynx, nasopharynx. The pharynx is leading to larynx. Larynx is leading to trachea. You can see here is the trachea. The trachea divided into the 2 bronchi. The principal bronchi, right and left principal bronchi. Now the bronchi divide into bronchioles. How many bronchioles are there? You tell me how many bronchioles are there. First there is primary bronchiole, which leads to secondary bronchiole, which leads to tertiary bronchiole. Tertiary bronchiole finally leads to terminal bronchiole. Terminal bronchiole leads to respiratory bronchiole. It leads to alveolar duct and finally alveolar sac. So you please learn the entire sequence of the respiratory tract. The last 3 things together known as sinus. What are the last 3 things, you tell me? So respiratory bronchiole, alveolar duct and alveolar sac together known as sinus. Sinus is the structural and functional unit of the lung. So this is the entire respiratory tract. The same thing is shown to you here also. So here we are starting with trachea, the lower respiratory tract, leading to bronchi, leading to bronchioles, primary, secondary, tertiary, finally terminal bronchiole, leading to respiratory bronchiole, alveolar duct and alveolar sac. You can see the last 3 things together known as sinus. So same thing is shown to you here also. Now with this revision, let's start asthma. What is asthma? Now there are some people who are very oversensitive. So certain people are the people have very oversensitive respiratory tract. So whenever any particular stimulus enters in their trachea and bronchi, their trachea and bronchi undergoing spasm. The stimulus can be different for different people. For some people, the stimulus is dust. So whenever they come in contact with dust, they inhale dust, they have attack of asthma. For some people, the stimulus can be the pollen grain, a particular pollen grain. So in a particular season, whenever a particular pollen grain is present in the atmosphere from the flowers, the person have the attack of asthma in that particular season. That's why it may be seasonal. It can be any chemical which is present in the air, any pollutant which is present in the air. So whenever a particular person comes in contact with a particular stimulus for which that particular person is sensitive. So for example, I am sensitive for the dust. So whenever I come in contact with dust, I inhale dust. So dust go in my nose, in my pharynx, in my larynx. When the dust particle reach my trachea and bronchi. So basically it's a disease of trachea and bronchi. Learn the level. So whenever the dust particle reach my trachea and bronchi undergoes spasm. It is a protective mechanism. So by undergoing spasm, the trachea and bronchi undergoing spasm, it prevents the entry of that particular stimulus, the dust particle, into the lower respiratory tract. So but if the trachea and the bronchi undergoes spasm, the dust will not go inside, I agree, but air will also not go inside. So person have dyspnea, person have cough. So that is the attack of asthma. So in asthma, there is over responsiveness of the respiratory tract in some individual to a particular stimulus. So can you see, whenever the dust particle goes inside in a normal individual who is non-asthmatic, you can see the trachea and the bronchi. They are not going spasm. They are not undergoing spasm. So dust will go inside and the macrophage will engulf them. But whenever the same dust particle or in a particular stimulus, maybe it's pollen grain, maybe it's a pollutant, maybe it's a chemical, maybe it's dust particle, it is going inside The asthmatic patient, you can see the trachea. The trachea is going in spasms. Compare the trachea. Compare. So it's a disease of the trachea and the bronchi. It's a disease of the trachea and the bronchi. So here also you can see whenever the particular stimulus, I will call it stimulus. The stimulus can be dust, can be pollutant, can be pollen grain. Whenever it is going inside, for different people the stimulus is different. Okay, for asthmatic people I'm talking. So this person is having over responsive respiratory tract. So whenever the stimulus go inside, as soon as the stimulus reaches the trachea and the bronchi, so the trachea and the bronchi undergo spasm. So can you see, this is the trachea and the bronchi. The trachea and bronchi undergo spasm. So it's a disease of the trachea and bronchi, not the bronchioles and acinus. So it's a disease of the trachea and bronchi. The trachea and bronchi undergo spasm. Since the trachea and bronchi undergo spasm, so patient have dyspnea, patient have cough, and patient have wheezing. So the three symptoms together known as asthma: dyspnea, cough, and wheezing, because patient have spasm of the trachea and the bronchi. Now to relieve this spasm, after some time it is automatically relieved, number one, or with the help of the treatment, the bronchodilators, the pumps and the inhalers, it get relieved. So either with medication it get relieved, or automatically spontaneously after some time it get relieved. So that is bronchospasm. So trachea and bronchi undergo in spasm, that is constriction, and that is the attack of the asthma. So asthma is not a continuous disease. It comes in attacks. Attacks means it's a paroxysmal disease. So whenever the person have attack, at that time person have the symptoms: cough, dyspnea and wheezing. Other time the person is normal. Whenever the person have attack, at that time the person have the symptoms. Otherwise the person is normal. So such a disease is known as paroxysmal disease. By paroxysmal, I mean the disease come in attacks. The disease is not constantly present all the time. The disease is not constant. No, it comes in attacks. So asthma is the paroxysmal disease. It occurs in a people who are having over responsive respiratory tract. So whenever they come in contact with the particular stimulus they are sensitive for, so there is spasmodic narrowing of the trachea and bronchi, which is relieved either spontaneously after some time or with medication or therapy. So the spasm occur at the level of the trachea and the bronchi, and etiology is the allergen. Different people have different allergen. The allergen for some people is dust, for some of them is pollen grain, for some of them is the chemical, for some of them is the pollutant. So please learn the level of obstruction. This is the third COPD I'm teaching you right now. If you are watching all COPDs together, you may be knowing the first COPD I taught you is chronic bronchitis. In chronic bronchitis, the level of obstruction is also trachea and bronchi. The second I taught you is emphysema. In emphysema, the level of obstruction is acinus. And third, I am teaching you asthma. In asthma, again, the level of obstruction is trachea and bronchi. And last, after this, I will teach you, there is a separate video, bronchiectasis. In bronchiectasis, the level of obstruction is bronchi and bronchiole. So you have to learn the level of obstruction in all COPDs. They are different. And the mechanism is different. So have a look here. You can see, have a look here. Can you see this is the trachea? Can you see this is the trachea? The trachea undergoes spasm. Can you appreciate? It is going spasm. So there is an air trapping inside. And that is leading to obstruction. That is leading to wheeze. So you can see asthma is a disease of the trachea and bronchi. So the trachea and the bronchi, the two bronchi, right and left. So trachea and the two bronchi, right and left, they undergo spasm whenever person is inhaling the stimulus. Whenever the stimulus is going inside, particular person have a particular stimulus. Stimulus is not same for all of them. Different person have allergy with different thing. So basically asthma is the type of allergy. What is the pathogenesis? Pathogenesis is type 1 hypersensitivity. So let me explain you the complete pathogenesis in a diagram. I will draw the diagram, then I will show you the flow chart. So this is the allergen. The allergen is different for different people. As soon as the allergen, this is the antigen. Antigen is the allergen. As soon as the allergen, it comes in contact with the person. For example, I'm having allergy with dust. So my allergen is dust. So whenever I'm inhaling dust, so dust is going inside my trachea and bronchi. So first cell it comes in contact is antigen presenting cell, APC. What does this antigen presenting cell will do? This antigen presenting cell will engulf the antigen. It will degrade the antigen into multiple pieces. It will process the antigen. First it will engulf, then it will degrade, then it will process, and after processing it will present it on the surface. It will present it to the next cell on the surface. That's why they are known as antigen presenting cell, APC, because they present the antigen. Now they present the antigen to the next cell. The next cell in the row is helper Th2 cell. Helper CD4, helper Th2, not Th1, helper Th2 lymphocyte. So whenever the antigen presenting cell present the antigen to helper Th2 cell, they get stimulated. Once they get stimulated, they secrete cytokine from them. Which cytokine? Interleukin 3, interleukin 4, interleukin 5, many cytokines are released. The most important among them is interleukin 4. This interleukin 4 goes to the next cell and stimulate the next cell. 5 cells will come in a row. You have to learn the sequence. The first is antigen presenting cell, then helper Th2 cell. Now the next cell is B lymphocyte. This was a T lymphocyte, now coming B lymphocyte. So this interleukin 4 will stimulate the B lymphocyte and convert the B lymphocyte into plasma cell. We know B lymphocyte convert into plasma cell. So B lymphocyte get converted into plasma cell. What does plasma cell do? Plasma cell form antibodies. So this start forming the antibodies. It will start forming the antibodies. So antibodies are formed. These are the antibodies formed by the plasma cell. You can see. Now there are 5 types of antibodies. IgG, IgA, IgM, IgD, Ig. Gamde, GAMDE. Okay. So out of these, not all 5 are formed. The last one, IgE, is formed. So here IgE antibodies is formed. The plasma cell is forming IgE antibody. This IgE antibody will go to the antigen, bind with the antigen, form antigen antibody complex, and there will be phagocytosis, the antigen is destroyed. So first time there is no allergy. So first time the antigen is destroyed, phagocytosis occur, antigen antibody complexes are formed, antigen get destroyed. There is no problem. There is no problem. This was the first episode. This was the first time antigen was entering in a human body. Now first time there is no allergy, please remember. Now the same antigen enters again. Now, just suppose I'm having the allergy of dust. The first time I came in contact in dust with my life, I don't have anything. But I have made the antibodies. Okay. Now, if dust comes in contact with me again, subsequently, second, third, fourth, fifth onwards. So, first contact, the second contact onwards. So, the same antigen entering second time onwards, second, third, fourth, fifth, anytime. So, it will come in contact with APC, but APC will recognize it. The body have the immunological memory. The immunity have a very strong memory. So this immunity will recognize it with the memory that you are the one for which we have already followed the process. We will not follow it again. You directly go to your antibodies. Actually, these antibodies which are present, Ig antibodies which are formed here, now I forgot to tell you, they will go and they will bind on the surface of the mast cell. They will remain in the blood. So this is a mast cell present in the blood, and these IgE antibodies which are formed, they will bind on the surface of the mast cell like this with Fc portion, and they will remain in the blood forever. So this is known as sensitization. This occurs during first time. Now second time when the antigen is entering, this is the first time. Now second time when the same antigen is entering the second time onwards. This is the same antigen entering second time onwards. So the body will recognize it, the immunity memory will recognize it that you are the one for which we have already conducted the process once. Whether it is after many years also, the body will recognize it. And we will not follow the process again. No, you directly go to your antibodies. So this antigen is diverted to its antibodies which are not free antibody. These antibodies are present on the surface of the mast cell. So antigen will go, bind on the surface of the antibody like this. The antigen will go and bind on the surface of the antibody like this. The antibody will get stimulated. This antibody will give the signal to the mast cell. Once the signal is delivered to the mast cell will rupture. Yes, this is known as degranulation of mast cell. The mast cell contains the granules and all these granules will come out. The granules will come out. This is known as mast cell lysis, mast cell rupture, and degranulation. The granules came out. Now, what does these granules contain? These granules contain many important things. The most important here is the leukotriene. It can contain prostaglandin also. It can contain histamine, serotonin, platelet activating factor. It contains many things. But for asthma, the most important is leukotriene. Now, these leukotriene receptors are present over the trachea and bronchi. So over the trachea and bronchi, the receptors for leukotriene are present. So in the blood, I don't have leukotriene right now. But whenever I come in contact with the dust, the complete process will follow and degranulation will take place and leukotriene will come in the blood. So leukotriene will go to its receptor and bind with the leukotriene receptor. This leukotriene which is coming out of the mast cell, it will go to its receptor which are present on the trachea and the bronchi, and it causes bronchoconstriction. It causes bronchoconstriction and person have the attack of the asthma. So this is how asthma attacks takes place whenever the person is coming in contact with the antigen. Every time, second time onwards. So third time also same thing will happen. Fourth time also, say every time it will happen. So asthma is a disease which comes in attack that is paroxysmal. And this is the complete mechanism that is known as type 1 hypersensitivity. So can we revise it once? First the antigen, first time coming in contact. First time. So what will happen? The first cell it will come in contact is antigen presenting cell. Antigen presenting cell will engulf it, degrade it, process it and present it to the next cell. The next cell is helper Th2 cell. Helper Th2 cell will get stimulated. It will secrete interleukins from it. Interleukin 3, interleukin 4, 5. The most important is interleukin 4. Interleukin 4 will stimulate the B lymphocyte. The B lymphocyte will convert into the plasma cell. Plasma cell will form the antibody. Which antibody? IgE antibody. This IgE antibody will go to the mast cell and bind on the surface of the mast cell and remain there forever. And this step is known as sensitization. This episode is over. Now these antibodies will destroy the antigen also. So this episode is over. Now the antigen is coming second time. The same antigen is entering second time onwards. So second, third, fourth, anytime the same antigen is coming second time onwards. So at this time, so this antigen directly go to its antibody which is present on mast cell. So it will bind with the antibody will give the signal to the mast cell will rupture. The mast cell will show the lysis. When the mast cell will show the lysis, the granules came out. The granules will came out of the mast cell. This is known as degranulation. Granules contain leukotriene. Leukotriene will go to its receptor, leukotriene receptor. The receptors are present on trachea and bronchi, and by combination of leukotriene with its receptor on trachea and bronchi, bronchoconstriction take place. Let me draw it. So you can see this is the trachea I am drawing. This is the bronchi I am drawing. On the trachea and bronchi, these are the leukotriene receptor. These are the leukotriene receptor. So whenever the leukotriene come in the blood, so this is the leukotriene coming in the blood. From where the leukotriene is coming? Leukotriene is coming by rupture of mast cell. When the mast cell is rupturing, leukotriene is coming. This leukotriene will come via blood and bind with its receptor. So whenever leukotriene come and bind with its receptor on trachea and bronchi, at that time the trachea and the bronchi undergo constriction. They undergo spasm, bronchospasm, and that leads to asthma. So that is the pathogenesis of asthma. That is allergy. Asthma is a type of allergy, and that is the mechanism of type 1 hypersensitivity. Okay, the same story is shown to you. The same diagram is shown to you. You can see this is the allergen. First time coming in contact with human body. You can see this is the allergen coming first time in contact. The allergen is going inside. Okay, the first cell it is coming in contact is antigen presenting cell. Antigen presenting cell is presenting to helper Th2 cell. Helper Th2 cell secreting interleukin 4, that is going to B lymphocyte. B lymphocyte convert into plasma cell. Plasma cell is forming antibody. Which antibody? IgE antibody. IgE antibody going to the mast cell and sitting on the surface of the mast cell. They remain there forever. This is sensitization. Now the same antigen entering again, so it is directly going to its antibody. Whenever the antigen binding with the antibody which is present on the mast cell, the antibody will give the signal to the mast cell. The mast cell will get stimulated, it will rupture, the granules will come out. Granules contain many things, they cause bronchospasm, they cause asthma. So you have to draw this diagram and you have to write the flowchart in your exam. You very frequently get question on pathogenesis in your exam. So you have to write down this flowchart. So whenever first time the antigen coming in contact with human body, it is captured by antigen presenting cell. Antigen presenting cell will present it, degrade it and present it to helper Th2 cell. Helper Th2 cell secrete the cytokines, interleukin 3, 4, 5. Among them, interleukin 4 is important. That stimulate B lymphocyte. That convert the B lymphocyte into plasma cell. Plasma cell will form IgE antibodies. IgE antibody will go and bind on the surface of the mast cell, remain there forever. This is sensitization. Now mast cells are fully sensitized. The episode is over. Now when the same antigen enters second time, so it will directly go to its antibodies. It will bind with its antibody. The antibodies will give signal to the mast cell. The mast cell will rupture. The granules will come out. Especially the leukotriene will come out. Leukotriene will go to its receptor present on the trachea and the bronchi, and they cause spasm. That leads to asthma. Here you can appreciate these are the mast cell. Appreciate the mast cell. This is the mast cell. Appreciate the mast cell. Appreciate the mast cell. On the surface of the mast cell, appreciate the antibodies. These are the IgE antibodies present on the surface of the mast cell. Now whenever antigen is coming and binding with the antibody is giving the signal to the mast cell is rupturing, and you can see the granules come out. And that is leading to the asthma. Okay, now there are two types of asthma. What are the types of asthma? Extrinsic asthma and intrinsic asthma. Whatever mechanism I taught you, type 1 hypersensitivity, that holds good for extrinsic asthma. For intrinsic asthma, we don't know the mechanism. It is some non-immune mediated mechanism. So we don't know the exact mechanism for intrinsic asthma. But for extrinsic asthma, that is the thing. Extrinsic asthma occurs in children. Here family history is also present. And here IgE antibodies are also raised, and here other allergies are also present. History of rhinitis, urticaria and eczema. In intrinsic asthma, it is present in adults. No family history, no other allergies, no IgE elevation in the blood. So that is the two type of asthma. Whatever I taught you, the complete mechanism holds good for extrinsic, not for intrinsic. So extrinsic occurs in children. So that is the two types of asthma. Now coming on gross and microscopy. In the gross, you can see the lungs are over distended because of air trapping. Now the trachea undergo constriction, the bronchi undergo constriction, so air get trapped inside, so air cannot come out. So because of the air trapping, there is over distension of the lungs, and you can see the mucus plugs are also there because of sometime now over secretion is occurring. So over secretion also block the lumen. So this is the normal trachea. In an asthmatic person, on coming in contact with antigen, the trachea undergo constriction. So the lumen become like this. So this is the trachea in a healthy individual, and this is the trachea. This is the trachea in an asthmatic individual. It is undergoing constriction. Okay. And the lumen is filled with the mucus also. Because there is over secretion of the mucus. So although the trachea is very narrowed because of the constriction, so whatever lumen is remaining even after narrowing, that is also blocked by the secretion. So that is the thing. So you can see the secretions here. Now coming on the microscopy, I am not teaching you the biopsy of the trachea and the lung. No. This is not the microscopy of trachea. This is not the microscopy of the bronchi or the lung. No, this is the microscopy of the sputum. Now in asthma, patient have cough. Patient have tremendous cough. Whenever the patient is in attack of asthma, patient keep on coughing. Okay. So whenever the patient cough, the sputum is coming. So what we are doing, we are collecting the sputum in a container. We are asking the patient to collect the sputum in a container. So this is the sputum of the patient, and we are taking the sputum on a slide, making a smear of that and seeing that, observing that sputum. So it is a microscopy of the sputum. What does the sputum contain? So this is the microscopy of the sputum of the patient with asthma. So this patient have asthma. We are talking about the sputum of the patient. We are talking about the sputum of the patient. We will make a slide of that. So it will contain triple C. The sputum contains triple C. What do you mean by triple C? It contains Curschmann spiral, it contains Charcot-Leyden crystal, and it contains Creola body. So C, that is triple C. Curschmann spiral, Charcot-Leyden crystal, and Creola bodies. That is triple C. C. So that is a microscopy of the sputum. What do you mean by that? What do you mean by that? What is the meaning of the three things? Listen. So this is the lining of the respiratory tract. That is pseudostratified ciliated columnar epithelia. The same lining is present everywhere in the entire respiratory tract. Now when the patient is coughing very vigorously during the attack of asthma, the patient is coughing. So these degenerated cells of the lining will come in the sputum. So here the sputum contain the degenerated cells. These degenerated cells which are coming from the lining, you can see they are coming from the lining of the lining of the mucosa. They get degenerated because of vigorous coughing, and the degenerated cells are coming. These are known as Creola body. So first C is Creola body, that is degenerated cells from the mucosa lining of the respiratory tract. So this is my trachea, these are my bronchi, they are lined by pseudostratified ciliated columnar epithelia. If the patient is coughing very vigorously, so the cells get degenerated and they come out in the sputum. Number one. Number two, instead of single cell, the complete strip can also the complete strip of the mucosa can also get dislodged and come in the mucus. So sometime in the sputum, you can get the complete strip of a big long strip of the mucosa lining, and that is known as Curschmann spiral. It is looking like a spiral. That's why Curschmann spiral. So you can see there is Creola body. What is Creola body? Single ciliated columnar cell which is sloughed off because of coughing. What is Curschmann spiral? The mucus plug contain the respiratory epithelium which are twisted. In the diagram also you can see this is Curschmann spiral. Can you see it is in the form of a spiral, the twisted strip of the mucosa lining. So that is the Curschmann spiral. I hope you got it. What is Curschmann spiral? And the third C. So one is Creola body, one is Curschmann spiral, and third is in the sputum, diamond-shaped crystals are present. Diamond-shaped crystals are formed. These are known as Charcot-Leyden crystals. These are due to eosinophilia. Due to eosinophilia, the diamond-shaped crystals are formed. That is Charcot-Leyden crystal. So in the diagram also, you can see these are the diamond-shaped crystals I am talking about. These are Charcot-Leyden crystals. And you can see the eosinophils. Creola bodies are not shown you in this diagram. So you can see the triple C. What is the meaning of the triple C? What we get in a slide of the sputum of an asthma patient. So let's write here the sputum microscopy in asthma. in asthma patient? We get triple C. What is triple C? One, degenerated mucous cells, that is Creola body. You can draw few Creola bodies. One is complete dislodged respiratory mucosa, that is known as Curschmann spiral. And the third is diamond shaped crystals, that is Charcot-Leyden crystals, due to eosinophilia. And you can draw many eosinophils also. So that is the triple C. You should label it Creola body, Curschmann spiral, Charcot-Leyden crystal. So please label the triple C, that is the microscopy. So that is the microscopy. Now coming on clinical feature, there is a triad. Three things happen. Patient have cough, vigorous cough. Patient have dyspnea. Patient can't respire because of the bronchoconstriction of the trachea and the bronchi. They are undergoing in spasm. So patient have attack of dyspnea, patient have cough, and patient have wheezing. So whenever the trachea is very narrow, the lumen of the trachea is hardly anything, very narrow trachea. So air is passing through a very narrow trachea and bronchi, so a sound is created. So that auscultatory sound, it is not auscultatory, it is heard as it is. So that sound is known as wheezing. So that is the wheezing. Okay, so that is the asthma. So we are done with asthma. Can we revise it quickly? So what is the definition of asthma? Asthma is a disease in people who have oversensitive respiratory tract. So whenever they come in contact with the particular stimulus they are sensitive for, so their trachea and bronchi undergo spasm, and because of which they have the attack of asthma. What's the location of obstruction? The location of the obstruction, I told you, it's trachea and bronchi. What is the etiology? The etiology is the allergen. Different people have different allergen. You can enumerate. It can be dust, pollen rain, chemical pollutants. It can be anything. What is the pathogenesis? You have to draw complete flowchart of type 1 hypersensitivity. So you have to draw the complete flowchart starting from the allergen entry till bronchospasm. How does it occur? So you have to draw the complete flowchart. You have to write down the cells which are coming in sequence, the 5 cells and everything. Now coming on the two types. The two types of asthma is extrinsic asthma and intrinsic asthma. So type 1 hypersensitivity holds good for extrinsic. It occurs in children. They have the family history, raised IgE level. But intrinsic one, this mechanism do not hold good, and there is some non-immune mechanism for intrinsic one. Grossly, the lungs are overdistended due to air trapping, and they have the mucus plugs also. Microscopically, I told you the microscopy of the sputum, and I told you triple C. So Creola body, Curschmann spiral, and Charcot-Leyden crystals. In clinical feature, there is a triad. What is the triad in the clinical feature? In the clinical feature, patient have cough, wheezing, and dyspnea. Cough, wheeze, and dyspnea together known as asthma. That is in attacks, paroxysmal attacks. So that's all about it. I want you to draw the well-labeled diagram, the flowchart of the entire pathogenesis in your exam. Pathogenesis is ultra important. That's all about it. So this is all about asthma. Don't forget to have a look on all the questions which are already asked on this topic. Thank you.